Welcome to another episode of Wealth Beyond Numbers. I'm your host, Dennis Coral. I'm the founder of Coral Wealth Management, and we're here with Dr. Ray Tolmos. We continue our conversation on healthcare. Dr. Ray, I'd like to change our conversation to, there's so much information that you're sharing. Thank you so much.
My pleasure.
But there's some questions that our audience asked that we wanted to ask you, some myths in
Let's do
regards
it.
to healthcare. One of them, you're also a chiropractor, not just
Yes.
an internist.
Right.
So, do you only go to a chiropractor when you're in severe pain?
No. You certainly can. But a lot of people really choose to use chiropractic as a way to help them feeling good as well, to kind of maintain their health. So people wonder, well, what does a chiropractor really help with? Number one, we can help to evaluate and discover why you have what you have. Many people aren't even aware that chiropractors can send for an MRI and send for an X-ray and really evaluate and diagnose your condition. So a lot of times we get asked, what's the difference between a chiropractor and a physical therapist? The difference is a chiropractor is a point of entry physician, which means whatever problem you have will either be able to figure out what it is and develop a treatment plan for you, or refer you to the right doctor that would be able to help you with that. So if it's a shoulder pain, we'd assess the shoulder, take a history, how did it happen, send for an X-ray or an MRI to determine what the actual injury is. If it's something that we say is, oh, you have a grade 3 tear here, that's not something that we can fix conservatively. You're going to need to see the orthopedic surgeon. Take these notes, take the MRI, there you go.
I see.
So we can evaluate all those issues, but then people come in a lot of times because they're like, just like stretching, it feels good for them. It helps them to stay aligned. It can help to relieve some of the stresses and get some of those kinks out, improve their ranges of motion. So a lot of people do it just to continue to feel good because they put a lot of demand on their bodies.
Yeah. I try to exercise often, so sometimes I get to have your aches and pains even though
Yeah,
you exercise.
right.
So that would be something that you would come to you to see.
Definitely.
It's for help learning how to do the best exercise to stretch
Definitely.
and I heard and I kind of believe this too that the key to a healthy lifestyle is movement.
100%.
So you
You
got
can never stop moving.
yeah,
Yes,
movement.
that's number one. Longevity, brain function, cognitive function, all of that is tied into muscle mass. So if you aren't using it, you're losing it, which means you better be doing things to maintain your muscle. And again, that's where peptides come in and nutrition comes in and all these things. But the right plan and the consistency with that plan is what's extremely important. So we help people develop exercise plans, stretching plans, and do all those things. Not just what we do in the office, but what they should be doing at home. And it's also based on not just their physical evaluation, but there's numbers. Depending on the type of stresses your body's dealing with, maybe CrossFit is too intensive a workout for you. Maybe you should be doing more restorative exercise. Maybe you should be doing, walks in the sun for 30 minutes and doing, kind of lighter weights with more rest time instead of just going, all out for an hour. So it really depends again on each person's situation, and there's different times where different types of exercise may be more applicable.
You actually are answering one of the questions, but that leads to the next question is as we all get older, should we focus more on also building muscle or
Yes, muscle mass is number one. Um, we have an in-body scale at the office so that we can actually see how much skeletal muscle mass, excuse me, our patients have. That is of the utmost importance to us. Body composition is the most important measurement that we can take and the most accessible measurement. You don't have to get pinched. You don't have to go to the lab. You don't have to, all you got to do is stand on the right machine and we can understand, are you at more risk here for, even things like Alzheimer's and dementia, and that skeletal muscle mass is a very valuable number, no question.
very very interesting. Yeah. So having the right tools, it's
Right.
important, I would say, at your practice. So what are those tools that you use in your practice to analyze someone's well-being or their numbers? What do you do in house, and what do
Right.
you send them out for labs?
So as far as what we have in house, we have the in-body scale, which helps us to determine weight, hydration, body composition, body fat, all those things. And then there isn't really too much diagnostic that we have in house. We do have somebody come in to do thermography, which is an alternative to like mammograms and those things, which for women's health, I am a big proponent of skipping mammograms and using thermography instead, because mammograms are applying a lot of compressive tissue and radiation to the breast, which is the tissue that we're trying to protect by doing mammograms, and instead we're injuring it on a regular
Yeah.
basis. So with thermograms, we can actually detect changes in vascularity that would be indicative of a problem that would show up on mammogram 18 months before it would even show up on a mammogram.
Oh, wow.
So if we can kind of be more proactive with that, then we can say, hey, what would we do if this mammogram came back with something suspicious? Well, we'd send for an ultrasound and an MRI. So the same approach applies. We find a thermogram that is off from the baseline. Let's do an ultrasound and an MRI. So again, very, very awesome tool there. But what we send out for, that's going to be all of your testing. I mean, I send people for EKGs, 24-hour Holter monitors, calcium CT score testing, MRIs, brain scans, CTs with contrast and without. We can look for tumors in the brain, on the adrenal glands, all depending on what the numbers are showing us and kind of what's going on. So any diagnostic test that's conventional, we have access to. We have different centers that we send to depending on
Mm-hmm.
the patient's
Wow.
location. And a lot of times those conventional tests get covered by insurance. So what really kind of sets us apart then is the functional testing that we do. So the functional testing is amazing because this is what helps us to understand, what is the function within the body, where is there dysfunction, and how can we correct it. The number one thing that we do with our patients that's a functional test is comprehensive stool analysis, assessing the gut. You asked about trends and all those kinds of things. Every day now, I'm getting studies that are saying this is linked to the microbiome, this is linked to the bacteria in the stomach. And that's something I've been saying for the past 12 to 15 years since I began studying this. I think in 20 to 30 years, everybody's going to be a gut doctor because of the importance of how those bacteria play a role in our overall health. So, comprehensive stool analysis, food sensitivities, gluten cross reactivity studies. We can do a test to detect if there's inflammation in the brain, in the border of the brain, if there's infections that have crossed that border. So for people dealing with anxiety and cognitive issues, and there's so much that we can look at between neurotransmitters and organic acids. I mean, the list goes on when it comes to functional testing, which is why we need to be discretionary with the choices that we make when it comes to this functional testing and understand what's going to have the most impact with people. That's where taking a very thorough history comes in, and where doing a very thorough physical comes in, because maybe we can figure out what's happening with conventional testing and get that covered by insurance to save patients money from having to come out of pocket so much for the functional testing.
You hit on a lot of different points, one of them being money.
Yeah,
Um, is functional medicine expensive?
it very well can be. There are some tests that cost literally hundreds of dollars, and I try to minimize that cost for my patients as much as I possibly can. But there's some clinics that you walk into and they just have a menu and they're like, here's the executive menu, and you get these three tests and it's $3,000, and this is just for testing. Um, Let it not any type of treatment or anything like that. So I like to really help the patient navigate what tests are going to be the most important for you. Now, again, I have people coming in who have done their research, and they're like, I want to do this test. And I'm like, okay, we can do that test if you want to. I don't think it's going to provide the most value here for you right now. Down the road, when we get there and we have these other issues addressed, yeah, then we can take a look at that again. It's more icing on the cake.
I see.
Yeah.
Yeah, you mentioned that. Yeah, sometimes we, as patients, try to do our own tests on our own because we think we know better. But
Yeah.
from what I'm learning from you, Dr. Ray, it's better to start with your foundation, as you said earlier. Do
Yeah.
your basic before going to any type of hormone therapy or supplements or peptides. You want to first know the basics, see if there's any pre-existing condition happening that is underlying that can prevent you from moving to the next level and the
Right.
next
For
area
sure.
and so forth. But that's great. Thank you for sharing that. Um, Another question that I have from our audience: do medical doctors and chiropractors do not, true or false, do not get along or work together?
Yeah, I would say it's pretty true in most cases. Not that we don't get along. but it's typically you're going to get conflicting advice. A medical doctor is going to tell you that that medicine is the only thing that's going to work, and a chiropractor is going to tell you, well, no, you don't have that disease because you have a deficiency of that medication. You have that disease because of A through Z. If we can address those things, you may no longer need that medication. So it's a different approach overall. Medical doctors don't, I'm not sure if they don't believe this or not, but that's not what their practice is predicated on, is that the body can heal itself. If you can remove the things that are preventing it from healing and add the things that it needs to heal, we can facilitate healing. That doesn't happen in medicine. So that's why there's always a clash. The best example of that is probably Tylenol.
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 Okay.
Why do we give people Tylenol?
Because you have pain. If you're a woman, maybe you're maybe going through your period, and that helps.
Let me facilitate this. What about kids? Why would we give a kid a Tylenol?
Well, the times I gave my son Tylenols because he had a run of fever.
A fever, right? So what does a fever do for us?
Well, my mom would say it's going to help you grow.
Well, okay.
That's what my mom used to say. The
Okay.
reason why you have a fever is because you're growing.
All right, so a fever is the strongest, most potent form of combat that our immune system has. Our cells can survive 106, 107 degrees Fahrenheit, most of them. Some are more sensitive. Most germs and viruses can't outlast more than 103 degrees. So we're literally burning off the pathogens with our fever. But what do we do with our kids as their immune system is trying to prevent this pathogen from learning our defense system and navigating around it and infecting us and making us feel worse and sick and potentially have adverse outcomes? We're numbing it. So my kids have had Tylenol, one of them. I have a 6-year-old and a 3-year-old. The older one has had Tylenol one time, and that's because I was just forced by the hospital. He had a very high fever for a little while. And the hospital was like, listen, we're gonna like call somebody on you if you don't allow us to give medication here. And I'm like, okay, fine. But my little one, who's 3 years old, had RSV at 2 weeks old. I mean, just craziness. The doctors are like, give him Tylenol. I'm like, no, yeah, but can we let his immune system fight, because that's what it's designed to do. And without giving my kids fevers, their first times, or Tylenol, excuse me, when they had a fever, their first few illnesses were very hard. It was rough, watching them suffer, but it's also an exercise for their immune system. It's how they get stronger. Now my kids get sick. If they get a fever, it might last a couple hours. They break it right away, and within a day, they're back to school. They're ready to go. Yeah, they have a cough that lingers for a little bit, but them actually feeling sick, very minimal downtime. And that's because we've cultivated and assisted their immune system instead of doing everything that fights against it. If you take an antibiotic, your body doesn't know how to fight that infection anymore. So helping people to cultivate their immune system is of extreme importance. So in the medical world, we try to prevent the body from doing what it needs to do in order to fight those, for comfort, so that they can feel better, whatever the case is. But most of the time, if you take a fever reducing medication, you're going to need some other type of medication to help your body fight that infection off. So
Wow.
again, it's conflicting advice from two different, but there's also the role of nutrition and the lifestyle that's there. My kids also, my oldest didn't have sugar until he was like 2. Like literally his first cake was it just like no sugar at all, and like he hated it. There was he took the smash pictures and all that kind of stuff, but why does a 1-year-old need to have a cake full of sugar? Like he's not going to remember it. He's not going to, all we're doing is hurting him at that point.
I agree.
So the nutrition plays a big role. Those things play a big role as well. So everything has to be congruent. If you're not going to take care of your child's immune system in that manner, and you're not going to give them the nutrition that they need and make sure that they're active and take care of their health proactively, then maybe it's better to go the medical route. So again, everything has to be congruent there.
I agree. And you have to lead by example. Like if I want my son to exercise, I have to lead by example, and I exercise. I
Yeah,
even bring him to the gym and make him some stretching with me before I do my exercise.
for sure.
But
That's great.
I'm 1,000% in agreement with you there. What happens with chronic pain?
So chronic pain is difficult because, again, usually multiple factors. most of the time with chronic pain, there was an injury a long time ago, and it kind of went away. Whatever it is, um, but whenever the body experiences a trauma, it adapts to that. The whole point of therapy and adjustments and all that kind of stuff is to help the body to adapt to a different trauma, right? One that we have controlled. That's what exercise is. It's trauma. But we adapt to that. And if we exercise the right way, then we adapt accordingly. And that's healthy. But say you're throwing a ball and, oh man, something popped in there. And then you just kind of take some time off and you don't really do anything about it. Yeah, you're fine. A couple months later, you're good. Years down the road, man, I have this thing in my shoulder, what's going on? And it may be from that same exact day that nothing was ever done and the body healed in a certain way to that trauma. And now that's increased, the joint degenerating and the muscles becoming weaker and then other muscles compensating. So there's usually some sort of a complex issue to be solved when there's chronic pain. There's also the metabolic side to it. So, is there vitamin deficiencies? Is there some sort of other immune system issue causing inflammatory, pro inflammatory problems? If you eat a diet that's very high in saturated fats and in sugars and in those things, you're going to have what are called pro inflammatory cytokines or chemical messengers floating throughout your body that help to decrease the size of your blood vessels and restrict blood flow, that increase what's called nociception or pain receptors. So, literally, your diet can be pro inflammatory to make you feel pain, or it can be anti-inflammatory so that you feel less pain and that you heal more efficiently.
Wow, that's interesting. That's so interesting. So, leading to what you mentioned, what can someone do when they realize they are in chronic pain? Or let's just switch the topic because not everybody is in chronic pain. When they realize, what I'm doing is not really working out for my health, what would be the first step that that person should do to improve? Is it different exams? Is it switch doctors? Is it look for holistic medicine? Is it look should somebody, the average person that's aging in their 40s
Yeah.
or approaching later years in life?
I think the most important thing is to look at the right numbers. It's to get evaluated,
Yeah.
And maybe that their current doctor, not that they need to fire their primary doctor. Again, their primary doctor, their goal is not to improve function. It's just to diagnose that disease. So I would suggest looking at, functional medicine. If there is a chiropractic internist around, that would be my number one recommendation, because it's not just functional medicine. It's looking at it through the lens of a primary care vision. Number one, is there any pathology here? We need to address that first. Number two, where is the foundational stuff? How is that happening? Unfortunately, because of the way that medicine has been going, a lot of medical doctors have become disenchanted because they really care for the patients and they want to do what's best for the patients, but their background and the way that they've studied it is different. It's still based on, oh, when somebody has this, we give them this. It's still diagnosis based. When people come to me and they tell me they have a diagnosis, I don't care what it is. I don't treat anybody based off of a diagnosis. It might tell me what tests I need to look at, but the numbers of each individual test are what tell me how to help somebody. Not because they have PCOS or because they have Guillain-Barré or because it doesn't matter. The disease does not matter. What matters is the function. So the diagnosis applied treatment plan for most conventional doctors is where there's an issue. Drugs, in order to pass all these clinical trials, need to be effective about 60% of the time. That's failing
It is.
almost half of the population, which is why, okay, if that one didn't work, we'll try this one. If that one didn't work, we'll try this. And it just becomes trial and error. How difficult is that really?
Yeah.
So the functional side of things is where it's very difficult because, again, you can have 10 people with the same complaint, 10 people with fatigue. It's going to be a different treatment plan for each one of them.
Wow. Wow. So it's not one thing solves it all. And you have to know your numbers.
Yeah.
And you can assume that the supplements are going to cure it all. It's just
Definitely not.
it's going to have, there's some more things underlying. That's what I'm learning.
Well, supplemental
Supplemental. Yeah.
means adding on to,
Correct.
right? It's not one and only all.
Right. You need to
it's
check out, are you exercising?
exactly,
Are you sleeping well?
exactly.
Are you
Supplements
drinking
are
enough
part
water?
of a plan,
That's-
not the plan.
That makes sense.
Yes.
Where do you see your industry evolving in the next 5 years? I know it's not part of it, but I'm
Yeah,
just
no, I mean, my hope would be that more people seek functional medicine providers like myself as their primary. Um, Now, I don't prescribe medications because I don't want to have that license because then I would be bound to that standard of care where if somebody came in order to keep my medical license, I would need to give them a specific medical treatment. I don't want to be bound by that, so I will never get my MD or practice with that license because I will then be restricted to having to do that. Um, but that as a primary care, looking at functional medicine, improving our functional health, and understanding these keys that we need to look at, the emotional, physical, and chemical health of our body. That's where I hope the industry is going over the next 5 years. And I see it trending that way. So many people now are like, I'm so tired of dealing with doctors who are just telling me I'll never do this again and I can't do this and I can't do that and just take this pill and everything will be fine, especially with all the information that's available now. So I do see things really shifting now.
I agree. That's a great way to end our segment that we just had. Great. Thank you so much. You share,
Yeah.
continue to share so much knowledge and wealth of information. So thanks again. Please stay tuned because now we want to know more about you and your practice on our next
All
episode.
right. Sounds good.
So hope you enjoy this episode of Wealth Beyond Numbers. I'm your host, Dennis Cora from Coral Wealth Management. And as we like to say at Coral Wealth Management, financial confidence starts here. Thanks for staying tuned. We'll see you next in our next episode.